All right. Well, good morning, everybody. It's a beautiful March 18th, 2025 today. We're going to be talking about two products that Heartland National has. One of them I want to do a little quickie on and just a refresher. And then the second one we'll do a deep dive. But the one that I want to do a quickie on is going to be on the hospital indemnity. Just a refresher for you guys. I have talked to so many agents that are selling Medicare Advantage, and they're not even mentioning hospital indemnity. And you're doing yourself and your client a disservice by not offering. You're screwing your client over because you could be helping them out, but you're also hurting your pocketbook by not offering it. So we'll spend a little quick time on that one. And then we're going to deep dive into short-term, oh, no, home. It is
Short-term
short-term
home health care, yes.
home health care, which could possibly almost be a $0 premium for your insurance, possibly. So we're going to dive into that. And with that, we have Bella from Heartland National, our rep. We got rid of the old, ugly, young Brandon. We're done with this, but and now
He's
we've got,
gone.
yeah, he's gone. I don't know. He's moved up the chain. He's probably the president of Heartland National now.
He's
But we
vice
now have
president of
Bella.
sales. Yep.
Yes, head of sales. There
He's
you
up
go.
there.
He's up there. Yeah, he doesn't mingle with us normal people now. And you tell him that sometimes he's got to come down to earth and maybe say hi to us little people
Hang
down here
out
in the
for a few
world.
minutes. Yes,
Exactly. And but Bella, I will let you take over. Thank you for joining us last minute. I appreciate that. So
absolutely.
let's do a little quick refresher on the hospital indemnity.
Absolutely. So I'll go ahead and get my screen shared here. Thank you for the introduction, Luis, and I'll introduce myself as a broker sales manager here. So my primary goal is to offer agents a direct point of contact. That way, if you have questions, if you need support, you need to pick somebody's brain to figure out how to get through the sales process from start to finish, whatever that may be. That's what I'm here for. That's what I'm available for. So you'll get my contact information here at the end. But without further ado, I want to get started with hospital indemnity. Now, this plan was built back in 2017. We actually are revamping this product and then we'll be relaunching it over the summer Q2 of 2025. So, as we go through these current features, current product features, I'll try to point out some of the differences that you'll see with that new product, some exciting things to look forward to as we're getting ready to file this new HIP with the states. So starting with state availability, we have this hospital indemnity plan available and live in 36 states that you'll see here in the orange. And I want to get started with some features and benefits, just an overall kind of overarching view of the product here. So this hospital indemnity is simplified issue, meaning we don't run a script check, we don't look at medical backgrounds, anything like that on the front end. We ask a series of health questions. If you're able to answer no to all of the health questions, you are issued a policy. So it's simplified issue. And then we have the guaranteed issue window. It's currently 12 months between the ages of 64 and a half and 65 and a half. So if the individual applicant is applying within that age window, 12-month window, there are no health questions asked on the front end. So they are guaranteed to be issued a policy without having to go through that series of health questions. This guaranteed issue window is something that we'll be extending with the new product that's launching in Q2. So you'll see it to be a little bit longer than 12 months, which we are very excited about. I know that's feedback we've gotten from a lot of agents. Issue ages on this hospital indemnity is 18 to 85 years old, and it's also issue age rated, meaning that these rates do not increase as the client ages. If they get a plan, it's 60 years old. They're paying that 60-year-old rate for the lifetime of the policy. It's very unlikely that they would ever see an increase. If that were to happen, it would be on a class basis. But of course, those premiums are not increasing as they age. This is a great way to create a sense of urgency with your clients. Not only do we know you're healthy right now or you're within the GI window, so we know you can qualify. But this is also the cheapest or the most affordable this premium will ever be. It will only get more expensive if you wait to get this plan 5 years down the road. You're risking changes to your health, being outside a GI window, and also having a higher premium at that point. So again, a way to create a sense of urgency when you're bringing up this product to your clients. Daily benefit amounts range between $100 and $600 for an inpatient hospitalization due to accident or sickness. I know some carriers only cover accidents, so we will cover accident or sickness between $100 and $600. And then the benefit periods, how many days this plan is payable. You can choose between 3 and 10 days, also offering 15, 20, or 31 days payable. So this allows this plan to be very customizable, allowing it to fit like a glove, is what we say around a Medicare Advantage. So for example, if you're looking at somebody with a $295 copay for days 1 through 6 in the hospital, that's typically what a United plan may look like for Medicare Advantage. You would want to structure this to give them a $300 benefit payable for 6 days. That way, for that high copay that they will see for days 1 through 6 in the hospital, they're completely covered. Heartland National is sending a check directly to them. We pay directly to the policyholder. We don't go through any service providers, through the hospital, anything like that. We're paying directly to the policyholder. We also have a restoration period of 60 days here. So using that same example, if somebody has that $300 benefit payable for 6 days, they end up in the hospital for 6 days. They've used up all of their benefits. They go into a 60-day restoration period in which their benefits are fully restoring back to 100% to be payable again. So even if they end up back in the hospital on the 61st day, their benefits have restored back to 100% to be payable again. Over here in the highlights, we've gone over most of these already, looking at a 7% household discount. This applies to if the individual lives with anyone over the age of 18. It doesn't have to be their spouse. You don't have to have 2 people applying unless you're in Ohio, Oklahoma, or Illinois. Those are 3 states that they do require a dual application in order to offer that household discount. In any other states, it can be anyone over the age of 18, as long as they live with them. We do have a 6-month pre-X here. Any claims filed within the first 6 months of the policy related to a pre-existing condition would not be covered again within that first 6-month window. Then we also have a 1-year contestability. So any claims filed within the first year of the policy that we would likely pull medical records if they applied outside of the GI window. So if they answered the health questions, we would pull medical records just to make sure they were truthful on those health questions at the time of the application, protecting us as an insurance company from someone who's lying to get coverage. If they answered no to a health question that they should have answered yes to, those are the type of things that we're looking out for during that contestability period. We do have dual applications available. So if you have a husband and wife applying at the same time, we have a $25 application fee, processing fee that's tacked onto the first month's premium for this product. However, if you do have that dual application, we would waive the second application fee. So it's still $25 versus $50 if you were to apply separately there. Any questions on the hospital indemnity features, benefits here before we move on?
See any questions, but I will tell you guys, this is something that is paired directly with a Medicare Advantage. Are you going to get into some of the products here, or are we kind of finish off with just these highlights on the hospital indemnity?
Yeah, I've got the riders to add on and kind of build upon the additional coverage you can add on, but anything you'd like to go over here, I'm all ears.
Okay, with the base plan, guys, I will tell you there, and it's dirt cheap. I'm talking $11, $14 a month when you cover their hospital copay, their ambulance copay, and their ER copay. They always offer those 3 at a bare minimum. And then you start talking about cancer. Mention it. Throw some statistics out there. 1 out of 3 women, 2 out of 3 men are going to get cancer at some point. And if you've got that cancer rider attached to this hospital indemnity plan, you now get a lump sum benefit, assuming it's a life-threatening cancer, payable to them to help them with their out-of-pocket, to help them with all the other medication costs or whatever other expenses they're going to have. Okay, if it's that serious of a life-threatening cancer, and they've got to go and go live in a city where they're going to get this treatment because it's the premier cancer center. Well, what about those apartment costs while they're living there? Medicare's not going to cover that. Your Medicare Advantage is not going to cover that. Talk about those additional expenses, offer a solution, throw the cancer out. I always like to start in the middle of the road. I talk 10K. 10K will at least cover two maximum out of pockets. Okay. And then leave a little bit of change. Oh, I can't afford that. Well, you start playing. Hey, what can you afford? What's within your budget? And then adjust. Okay. So it ultimately is a very easy sell. The problem is agents aren't offering it. That is the problem that I'm seeing. So any questions, guys? I'm looking at the chat right now. I don't see, okay, I do see one right here. Here we go. I didn't see it. Nice benefits, peace of mind. Yes, definitely. I agree with you, Liz. Just offer it. Here's the other deal. I will tell you this, all you guys that are on here right now, one of your clients comes into my office for a review, which of course they're not, but a good agent would throw you under the bus. Okay. And this is what they'll say, because this is what I would say. Do you have a hospital indemnity, right? Your previous agent offered you this plan that does this for you. And as soon as they say no, I'll be like, I don't know about that agent. I don't think they had your best interest in mind, or maybe they just weren't that good of an agent. Let me tell you how this is going to help you out. I'm going to throw you under the bus. Now you're a goner. Okay. So think about at least preserving your book. Offer it. Okay. Maybe you offered and they forgot about it and you did your job. Who knows? But either way, throw it out there, guys. Okay. All right. This is just to confirm, this is available for clients under 65. And yes, that is correct. Okay.
Yeah, all the way down to 18 years old.
18 years old. So you can throw this to your ACA book of business if you want to. I tend to focus mainly on the Medicare side with Heartland National, but you can definitely offer it to people under 65.
Yeah,
okay.
I'll show you a good writer that seems to be very popular with the ACA market for those who
Okay,
are
let's do it. Let's jump right into that.
And Luis, I like that you brought that up when somebody it starts coming at you with the objections saying, well, this is too expensive. This is a lot that I would be paying every month for this plan. And at that point, I think math equations are really effective to show them and allow them to understand this $20 seems expensive to you now. So what happens in the event that you are hospitalized for 6 days, or you do end up with a cancer diagnosis? Are you comfortable paying $10,000 for that cancer diagnosis, travel and lodging costs, non-medical chemotherapy, the comprehensive out-of-pocket exposures that you're subject to in the event that something happens? So I think that that's a really good point as you're starting to play with the premiums, going through the quote builder and pointing out, this may seem expensive, paying $25, $30, $45 a month, but in the event that something happens, are you comfortable paying $2,000 for that hospital stay? Are you comfortable paying $10,000 for that cancer diagnosis, whatever that may be? So I'm glad you brought that up. I think that's a really great point.
And guys, what Bella just brought up right there, this is Sales 101. Okay, you have to be prepared for the objections. Okay, you need to practice. Okay, get in front of a mirror. Okay, you offer it too expensive. You don't need to sit there and like, what do I say here? And you're like, okay, maybe agree with them, but have your comeback. Usually that is too expensive. It's just a smoke screen. Okay, they're just putting it out there. Okay, you got to break through that smoke screen. Practice the objections. Okay, it's too expensive. Hey, I got to talk to my spouse about this. Hey, I think I got something somewhere else. Hey, have every single one of those objectives already, have them in your mind, how you're going to combat them. Those usually are your best salespeople. I'm like, damn. I would tell you, on a side note, have you guys ever gone on a vacation, especially Vegas, and they get you for these timeshares where they give you a free something? Okay, guys, if you've never done it, it's a hard. You've got to go in there. I love going to these. My wife hates them because they're like 3 hours of time, but usually we'll get a show or something out of it. But I like to go because these guys practice their sales skills and just listen to them. I mean, you throw an objection to these, and they're selling timeshares. They are so good. Yeah, it's just like you can't throw an objection out there that they don't have an answer to. And but and it's tough. You may walk out owning the timeshare, which hopefully you don't. But going in there and just watching the sales process that they have is pretty neat. Anyway, just a side note.
Yes,
we do have a note. We do have a question here. Bella, what cancers are covered and at what stages?
Yeah. I have a couple things to mention with the base plan, and then I'm going to go over exactly what's covered with that
Okay,
cancer rider on the next slide. And
perfect.
one other thing I want to note with when it comes to overcoming objections and kind of going through the learning about the sales process. How do you identify the needs? How do you position the product as a solution? Some of these sales 101 skills as they pertain to cross-selling and some of these ancillary products. We, Heartland National, started a call every Wednesday at 10 a.m. Central Time. And the goal with this call, it's called the Agent Advantage, is to go over a different sales skill or sales tactic, sales topic every month. So February was overcoming objections. March is needs-based selling. So identifying the needs, positioning the product as a solution, kind of going over what questions can I ask to get them to talk about the pain points or the needs. And then what benefits do I share about this product to help them understand how it's a solution? We focus each week of the month on one of our products in particular. So this upcoming Wednesday is needs-based selling for cancer, heart attack, and stroke insurance. And then next week, we'll do an overview of all of the ancillary products, going over needs-based selling as a whole. So Luis, I'll make sure that you have the link to register for that call, QR code to register for that call. That way you can distribute that to all of your agents. I think that that'll be really, really helpful, beneficial if you're able to join us.
Oh, I just the one that I missed. Do you happen to have a recording of it?
We do have recordings, and we're working on uploading those to our agent portal for compliance issues. Sometimes they don't necessarily want us sending those out to agents. That way, if benefits were to change, anything like that in the future, we're able to take it down from our website, but they will be available from the agent portal.
Okay, beautiful. So, guys, what I would do is when I get that registration link from Bella, I'll share it with you guys, and you can register and come, and join them on those meetings. I think that's great. I didn't know about that.
It's new. It's fairly new. We've been working on marketing, making sure we're getting e-blasts out pretty frequently to gain more traction from agents, but it's gone
Awesome.
really well so far. So I would love for you all to join us. Awesome. So in that base plan, a couple things that are built in, one being an emergency room benefit, paying $150 per trip to the ER, up to 4 times per calendar year. Then we also have a built-in observation room benefit. So oftentimes you go to the ER, you are sent to an observation unit to be monitored. This could just be a couple of hours. You're not admitted to the hospital, so you don't have that hospital confinement daily benefit amount, but you're spending time in observation. So we would still pay their base plan benefit, the amount that they selected up here, for their time spent in observation. And the cool thing about that is there's no time minimum that they have to be there. So like I said, even if they're only in observation for a couple of hours, they still qualify for this observation unit built-in benefit. So going back to marketing 101 here, I think that there's a couple buzzwords that you can kind of use to help your client understand what they're getting out of this plan. We love to hear, as consumers as a whole, we love to hear included, built-in, discount, free. So those are all words that you can use with these emergency room and observation room benefits. These are free. They're not paying any additional premium in order to have these benefits that are built into that base plan. They have those regardless. Regardless of what they choose for this top number, they will have these benefits built in. So a good point to make there is you're positioning this to your clients. Also looking at the emergency room benefit, I know oftentimes on a Medicare Advantage plan, if you end up going to the ER and then you're admitted to the hospital afterwards, they waive that emergency room copay. So you may not even owe anything for that trip to the ER since you were then admitted to the hospital on your Medicare Advantage plan. Heartland National pays regardless. We pay directly to the policyholder regardless of the copay. So even if their $135 emergency room copay was waived, they paid nothing for the emergency room visit, they're still receiving $150 from Heartland National. So a very good selling point there. This is going to pay you regardless. If your copay is less, if your copay is waived, you paid nothing, you still have that $150 benefit going directly to you. Diving into the first rider, we have lump sum cancer here. You can choose lump sum benefits between $1,000 and $20,000, covering internal cancer at 100%. This would be the percentage of their benefit amount. So for easy math purposes, we'll use a $10,000 benefit. If they're diagnosed with internal cancer, including melanoma, they would receive a check sent directly to them for $10,000. If they're diagnosed with carcinoma in situ, stage 0, non-invasive, pre-invasive cancer before it's metastasized, they would receive 25%, so a $2,500 check sent directly to them. If they're diagnosed with skin cancer, this is what we would classify as the basal and squamous cell diagnoses, so something like getting a mole removed. This would pay a 5% benefit, a $500 check sent directly to them. And then this rider also includes the duration benefits. This is huge. This is pretty rare to find on a cancer rider or a cancer standalone plan. It's built in, so no additional premium to have this benefit, gradually restoring back to 100% on a 5-year scale to be payable again, protecting clients from that subsequent diagnosis if they do endure a second diagnosis in their lifetime. Next rider, we have lump sum hospital confinement. So we see this to be really popular with the ACA under 65 market. This pays a lump sum between $500 and $2,500 for their hospitalization, payable up to 2 times per calendar year. So for someone who is trying to meet a deductible, they don't necessarily have that daily copay for days 1 through 6, whatever that may be, this lump sum hospital confinement rider will be really beneficial for them. With the new hospital indemnity coming in Q2, you'll see some flexible base plan options, so still having the ability to choose the daily benefits payable for amount of days, but also having an option to choose a lump sum benefit as the base plan. So structuring this for somebody on an ACA plan to best fit their needs there. Next, we have the lump sum outpatient surgery benefit rider. This pays between $100 and $1,000 for up to 2 procedures per calendar year, surgeries performed in an outpatient surgery facility. Then we have the skilled nursing facility rider, 2 options to pay here, either $150 or $200, paying days 21 through 100. Typically on a Medicare Advantage plan, you'll see that days 1 through 20 in a skilled nursing facility have a $0 copay. So you're good to go for days 1 through 20. And then for days 21 through 100, we see a big jump up to $195, $210, $209, whatever that may be. So again, this plan is designed to fit like a glove, so we are picking up where that Medicare Advantage plan is dropping off. Next, we have the ambulance benefit rider. This pays a fixed $200 benefit up to 3 trips in an ambulance per calendar year, covering ground, water, and air services. With the new hospital indemnity, you'll see some more flexibility with this ambulance rider, having the ability to choose between $100 and $500 for that ambulance benefit rather than just the fixed $200 benefit. And that will still be an extremely affordable premium. For a 65-year-old, that will be $1 per $100 unit. So a 65-year-old applying for a $300 ambulance benefit would be $3 a month, right? A $500 benefit, $5 a month, so on and so forth. The wellness benefit rider pays $25 per health screening test, up to 4 tests per calendar year. So the ability to receive $100 in reimbursements back to them. We have a list of the covered wellness tests over here on the side. Some of the big ones being your annual physical exam, immunizations, getting your flu shot every year, vision and or hearing exam, pap smear, mammogram, colonoscopy, chest x-ray, the list goes on. Lastly, we have the dental, vision, and hearing rider. 2 benefit amounts here, $1,000 or $1,500, that being the maximum benefit reimbursement per calendar year. There is a $100 deductible, but a couple things aren't subject to that. So first being $75 for a dental cleaning twice per calendar year, so once every 6 months, as well as $50 for a vision and or hearing exam once per calendar year. So 1 time per calendar year being the maximum there. And then one frequently asked question that I think we see here with hospital indemnity is, I'm outside of the GI window. I have an extensive medical background. I can't qualify for this plan. So what do I do? How can I still get that hospital coverage if I don't qualify for hospital indemnity? We do have a solution for you here. The short-term home healthcare plan is a perfect plan to pivot to. It has 3 to 4 health questions, very minimal underwriting no matter what. And it has a hospital confinement rider. So you can pivot to this product, add on that hospital confinement rider. So your client still has that inpatient hospitalization coverage without having to go through the extensive health questions. So I'll take a moment here to jump back into the chat and answer some questions.
Yeah, so let's do that. So let's go with, okay, so we covered what cancers are covered in at 1 stages. So I think we're good on that one. Glutch, if you need us to elaborate more on that, let us know. So this $20 is for everyone on the premium depending on age. Is that the fee? Or is that what you're referring to? Is that the fee, Gus? Let's see now who asked me that question. You, Irene.
Yes, I mean, if that's the premium for everybody, or it depends on the age and everything else.
Yeah, Irene, it depends on the age that you're applying at. So
Can you
if
do can you do like an example of a 60-year-old?
absolutely, let me get our agent portal pulled up and I'd be happy to do so.
Let's see who wins. Let's see who wins because I'm pulling it up
Are you
here.
pulling it up too? Uh-oh, we're
Let's see.
racing.
Oh man, I got you, girl. I got you.
Oh
All right.
man. Okay.
Yeah,
I'll
okay.
let
I'm
you
gonna
take it
share
away
real
though.
quick. I'm gonna share for you real quick, Irene. Okay, let's see here. All
Let
right.
me stop my share and I'll let you jump on there.
So I'm on the dashboard. So we're gonna go over here and we're gonna go to hospital indemnity. Okay. Let's put a 60-year-old would be what year? Let's see, we're 2025 minus 16. Let's go to 01/01/1965.
65.
Okay, let's say we're going to choose a $100 benefit for 5 days. Okay, they're in Texas, and let's say that they're married. Okay, I go down here and I add the ambulance. So base rate, look at that. I said $11 to $14, $8 for $100 a day for the hospital. The ER, $150. Okay, and then the ambulance, $200 reimbursement. Then we go on here and you can select the lump sum cancer. Go to 10K. Now I'm at $31. Okay, you can start adding the lump sum hospital, the outpatient, skilled nursing, wellness, dental and vision, and hearing indemnity. But this is my go-to right here. This is what I present. $31. Okay. Now we know there's a $25 app fee. So what we're talking, what, $56 initial, and then $31 a month. Okay. I need your routing number and account number. Let's go.
Let's
I
go.
don't ask if you want it. I'm asking, I need your routing number and account number. And
Yeah.
that's rocking.
Yeah.
Okay.
So
Irene, is that good for you, Irene?
Yes, this is amazing because I tried to do it with, I think, Allstate, or is this a different company?
Yes, completely different. So I tend to use Allstate Health Solutions for my ACA book of business. Okay. I do not use Allstate for Medicare. Okay. Then this is Heartland National. I like to use Heartland National for my Medicare side of the business. Okay. You can also use it for under 65. Okay. The problem that I see sometimes is that if you've got a family, you got young kids under 18, well, Heartland National won't insure under 18.
Yeah, the only plan that we will insure dependents, children under the age of 18, is on our cancer, heart attack, and stroke standalone plan. We do have family plans available there, so you can claim dependents under the age of 18 on a policy to provide children with that cancer coverage as well.
This sounds great. Thank you. Thank you.
Absolutely, Irene.
I
And
want to be
Gustavo,
appointed. Yes,
yes,
I'm not
yeah, let's
appointed
get
with
you
you guys.
contracted. That's another thing. Our contracting process takes less than 24 hours most of the time. We'll get it sent out to you. As soon as you get through step 1 through 9, I think it takes about 20 minutes, less than that maybe. Our agency services team can get you approved and ready to write your first policy that same afternoon. So we're really quick, and I'll work with Luis to make sure that you all have everything you need. Gustavo, it looks like in here asked, will this plan still pay if the client has coverage with another company? If they have a MetLife plan, can they still get a Heartland National plan, and will this still pay? We pay regardless of the copays, regardless of what they were charged from the service provider, and regardless of what other plans they have in place. So if somebody does have another plan similar to this, or their primary insurance provider is picking up all of the costs, whatever that may be, we pay directly to the policyholder. So we don't really care what other coverage they have. They signed up for a plan. They have fixed benefits in place. So we are paying them those fixed benefits no matter what. Yeah, we don't unfortunately have Michigan yet. However, we did just recently receive. We're working with some investors to put some more capital into the company as we're launching a fixed indexed annuity. So we are hoping to expand into Michigan, Minnesota, and Wisconsin this upcoming year.
Beautiful. All right. So guys, I want to, we've gone about more than 30 minutes on the hospital indemnity. We've done a full training on the indemnity. I don't want to miss out on the short-term home health care because guys, depending on how many meds our seniors are taking, this thing has a potential of not costing them a penny. So let's jump into the home health care, guys. And then ask me if you got more questions on HIP, I'll be glad to take them. I'll respond. But I want to dive into this.
Let's do it. Perfect. So looking at the availability map here, some states are a little more strict when it comes to short-term home health care. They like it to be structured like a long-term care policy. So not quite as extensive with the amount of states that we're in with this home health care plan, but we do have a few big ones that we're excited about. Issue ages on this plan is a little bit of a smaller window between the ages of 40 and 85 years old. The rates also are attained age rates, so they increase in 5-year age bands on this plan versus on the hospital indemnity, we have the issue age rate. So they're not increasing over time as the client ages. They do increase on this plan. As we go through the benefits, however, I think you'll start to understand why those premiums increase over time because like Louise said, there's a very good chance when they get this plan that they're not paying anything for it at the beginning. The 3 package plans that we have on this home health care plan are basic, standard, and complete. Everything is going to fall under those 3 package plans. So as we go through the benefits, you'll get to see what's included where. Looking at the highlights over on the side, home health aid and prescription drug reimbursements are built into this base plan. So not only are they getting the home health care benefits, but they also have home health aid and prescription drug reimbursements. Like I said, it's very minimal underwriting. It's 3 to 4 health questions, no matter what riders they add on, anything like that. So very minimal, very easy to qualify for. 6-month pre-X, just like hospital indemnity, and a 2-year contestability period. So hospital indemnity is a 1-year contestability. This home health care plan is a 2-year contestability. So any claims filed within the first 2 years of the policy, we would pull medical records just to make sure they were truthful on the health questions at the time of the application. Like I said, health questions are very minimal. We'll go over those here in a minute. So you shouldn't have many issues with not qualifying for those claims or benefits. This is it for the health questions. This is it for the underwriting in order to qualify for this plan. In a nutshell, those first 3 questions are asked for the basic and standard plans, the lowest and middle levels of coverage. First question, are you already receiving assistance performing ADLs? Second question, are you already receiving home health care services, confined to a rehab, skilled nursing, or assisted living facility? Third and final question for that basic and standard plan, do you have a cognitive impairment, Alzheimer's, dementia, or memory loss? If you're applying for the complete package, that highest level of coverage, we have 1 additional question asked down there at the bottom. In the next 60 days, do you expect to be admitted to the hospital, nursing, assisted living, require home health care services, or do you have a surgery planned for the next 60 days? And that's it. Doesn't matter if you add on that hospital confinement rider. Doesn't matter what riders you add on. This is it. That's all you're being asked in order to qualify for this plan. So looking first at the home health care benefits, this has 360 days worth of benefits with a 180-day restoration. So even if the individual uses up all 360 days of benefits, they go into a 180-day restoration where they have sufficiently recovered. If they need those home health care services again on the 181st day, they are eligible to receive those benefits again, covering a variety of different services. So for example, my grandfather had a shoulder surgery. He had a physical therapist coming out to his house twice a week, as well as a skilled nurse coming to address wounds, do wound care, medications, things like that once per week. On the complete plan, that would have been a $300 benefit for all three of those services, the 2 physical therapists and the 1 skilled nursing. So that would have been $900 going directly into his pocket, a check sent directly to him for $900 every single week during his recovery. And if you do the math here, if you're maxing out that benefit, having $600, so 2 services may be coming out per day, $600 payable for the full 360 days is $216,000. Again, subject to a 180-day restoration. So if they max out those benefits every day for 360 days, they go into a 180-day restoration. They have fully restored to be payable again. Next, looking at the home health aid. So this is assistance with those custodial needs. A lot of times an objection you may see is, well, doesn't my Medicare plan already cover this? I don't understand why I need this plan in place. They may cover those home health care benefits. They're not covering custodial needs at all, however. So this has a $50 through $150 benefit, depending on your plan, for 120 days of custodial needs, home health aid needs, built into the base plan. Somebody who's helping you cook, clean, throw in a load of laundry, or reach the peanut butter jar on the top shelf, whatever it may be. Assistance with those daily activities, day-to-day tasks is something that these home health aid benefits is going to cover. Again, going directly to you. And then the cherry on top of the base plan here, the built-in prescription drug reimbursements. We reimburse $15 for every generic medication and $30 for every brand medication up to the annual maximum of $360 on the basic plan, $720 on the standard and complete plans. So, for example, somebody on a standard plan at 65 years old, that's about $43.54 per month. That comes out to be what, $516 in annual premiums. $516 is what they would pay in annual premiums, and they have the opportunity to receive $720 back for prescription drugs. A couple things about that: we pay regardless of the copay. So even if their copay is $0 across the board for their prescriptions, we still reimburse $15 if it's generic, $30 if it's brand. We also start paying this day one. There's no waiting period, no pre-X, anything like that for these prescription drug reimbursements. Looking at the riders available, we have hospital confinement on the complete plan going up to $300 per day, payable for 3, 6, or 10 days. This acts exactly like a hospital indemnity base plan would. Then we also have the ambulance rider, having the opportunity to choose between $100 and $500, up to 4 trips in an ambulance per calendar year. For a 65-year-old, this is $1 per $100 unit. So that $300 benefit is $3 a month, $500 benefit, $5 a month, so on and so forth. Next, we have the severe accident and accidental death benefit rider. 2 options for the death benefit here, $5,000 or $10,000, also covering a variety of dislocation and fracture benefits due to an accident. This is another extremely affordable premium. That $5,000 benefit is $3 a month for a 65-year-old, $10,000 benefit, $6 a month for a 65-year-old. And then lastly, we have the home health aid benefit rider. This adds an additional 60 days of coverage to the 120 days that are built into that base plan for home health aid. So bringing it up to a total of 180 days payable, also subject to the 180-day restoration. So even if they use up all of those benefits, it's not one and done. They can fully restore over the course of 180 days to be completely payable again for home health care and home health aid. Any questions about those riders before we go into a couple frequently asked questions here?
And I've already ran some rates here, Bella, that we can share.
Awesome, awesome. Well,
Can
cool.
you go back to the screen about the 3 different plans?
Yes, absolutely. For home health care?
Yes. Okay. So guys, here's what I did. I just took, Irene, I took your 60-year-old guy and I ran him a complete quote. Okay. This one here on the full right. Okay. So, and then we'll get to some questions here. Check this out. Okay. Where is my little, here we go. Okay. So I ran a quote. I put the 60-year-old. I chose the complete benefit. I chose a hospital confinement of $300 a day for 6 days. I went and added the, why not? We'll add this one, minimal premium. I added the home health care. I did the 60 days and I added the ambulance service rider, $500. My total premium here is $53 a month. All right. Now, Bella, help us out here with, let's assume that this guy is taking some medications. What's the reimbursement looking like for this individual?
Absolutely. So they're paying, what was that, 53.37?
53 and change.
53.37 times 12 comes out to $640 for their annual premium. That's what they would pay for the entire year, every month for those annual premiums. They have the opportunity on that complete plan to get up to $720 back in prescription drug reimbursements. So if they have, say, 2 generics and 1 name brand that they're getting filled every month, say they take Januvia, which is a name brand, and then they also take 2 generic medications, that's $60 in reimbursements that they can get every single month, adding up to that $720 that they can get for the entire year, reimbursement sent directly back to them as the policyholder.
All right, so we got $700, we got $60. So I'm shorting myself. I'm going to bump this up. Let's go to maybe what can I do here? I don't think there's anything here I can increase except maybe go to
maxed them all out.
I take this to 10 days, guys. I'm at $55 a month. I don't think I can do anything else for this 60-year-old individual. And he's going to pay $55. Remember, they're going to charge him $55, but he's going to get reimbursed $60. So the net of this, he's actually going to make a profit $5 a month. So think about this, guys. Now we get commission on the full 55.
Right, you're making commission on the premium. Yes.
On the premium, not the net, not the reimbursement that they're getting. That's not going to affect it. So this could potentially be free. Now this is a 60-year-old. Let's see here. I wonder, can I go back and keep the same benefits but change the age here, Bella?
It may force you to, if you change the birthday, it may clear your benefits. Let me
go back and let's add it is. Okay, so let's go add somebody new to Medicare. So they're going to be 1/1/1960. I'm going to choose the complete again. Okay, I'm going to choose Texas. All right, here we go again. Complete. Let's go to $300 a day for maybe 6 days. Oh, I'm already at $72. So the age matters, guys. The age matters. So maybe I do 3 days. If they already have a hospital indemnity plan, I don't need to add this. Okay, right? I don't have to choose that. Oh no, it is required. Well, maybe
no, you don't have to. It's coming up with that required field since you have a benefit period. So deselect the benefit period as well.
Gotcha. So maybe I add this for sure. I want this, maybe $300. I'm at $58 right there, guys. $58. And so they're going to net $1 and change profit every single month.
And Luis,
commissions, guys. Okay, go. I'm sorry, Bella. Go ahead.
No, you're good. You're good. The standard plan will also meet the maximum of 720. So that may take a little bit of premium off as well. Wasn't a huge difference, but a few dollars, $4, I think, is what it took off there.
I don't know the commission structure, Mary. Good question. And we don't do commissions in general conversations. So hit me up. I posted my email. I'll send you over contracting for this. And you'll see the commission schedule when you contract, but it's pretty darn good.
Pretty darn good.
Pretty
And
darn
Gustavo
good.
asked, would this coverage help for somebody who maybe had a knee replacement or a hip replacement? Absolutely. In order to get a physical therapist, some of those home health care services that are coming out to your home, they typically won't just come if you call. You have to have a doctor that's prescribing the need for those services performed in the comfort of your own home. So somebody can have a physical therapist after that knee replacement come out a couple of times a week. The doctor would prescribe it, and then all we need is for them to just submit an itemized bill, and then we pay directly to the policyholder. So again, regardless of what their other plans are paying, or regardless of, I don't know, what their copay is, whatever that may be, we would pay their fixed benefits directly to the policyholder.
Now, Gus, one thing to be careful. So if a guy comes in, and Bella, correct me if I'm wrong here. So I enroll my Medicare beneficiary today. Okay, he's going to start April the 1st. If he's already got a diagnosis for this hip or knee replacement, are you guys going to cover, is that considered a pre-existing, or will it cover?
Yes, if you already have the surgery scheduled and then you try to get this plan in place, that would fall under the pre-ex. So again, that 6-month pre-ex is any claims filed in the first 6 months that are related to a pre-existing condition would not be covered. So we know that you've tried physical therapy, you've gotten x-rays done, now you know that you need a knee replacement, and then you get that surgery in the first 3 months of the plan. This wouldn't be covered since it's related to that pre-existing condition.
So just be aware of that, Gus. I have been asked that, well, I'm having surgery next month. I'm like, oof, you already got a diagnosis.
Right,
Now,
right.
Medicare policy, you'll be just fine with the Medicare policy. You're not going to have any issues with that MA. We're talking about this specific short-term home health care policy. Pre-X is going to apply.
Absolutely.
Okay. Are you guys in New Mexico for this product?
Let me double check the map. I just saw that question. I believe we are. Oh, no, unfortunately, we're not in New Mexico. I thought
But you are for the hip,
sure.
right?
Yes, for the hospital indemnity, we are. Yes.
Okay. So for the hospital indemnity, yes, Irene. For this one in New Mexico, not yet. Hopefully they'll start getting in there and doing that.
Yes. Yeah. Some states are just a little tricky when it comes to approving those home health care plans. But I do think that's all that I have for you all. I'll throw my contact information up just so you have that.
And guys, here's what I'm going to do. I'm going to hit you up with my email. Send me an email, guys, and I'll send you over contracting. And you'll get access when we do the contracting. And let me see what my contracting, I can't remember. You'll have access. Let me get back into my dashboard. So, Irene, I'm going to go ahead and email you. Let's see, come on, get to my main dashboard here. Okay. Just trying to get there. But I think you'll get access to the HIP, the short term, and I think also MedSup. Is that right, Bella?
MedSup is only available in 10 states, but yes, with a health contract, if you are selling MedSups in the 10 states, we have them available, then yes. And then we also have the cancer, heart attack, and stroke standalone plan that will be available with your health contract as well.
And so when I send you the email, guys, it'll come to you directly. I go plug in your information, and then Heartland National will send you an invite, and then you'll contract, and you'll be good to go. But it's a really good product, guys, just to throw out there. Remember, don't let me throw you under the bus for not offering this to your clients or another agent. Okay, the odds I'm going to do it is rare. Any other questions for Bella, guys? We got Bella on here. Anything you want to ask, unmute or just type it away. Your call.
Yes. Last question. Thank you. Thank you so much for the information. But
Absolutely.
I wanted to know, like, let's say they don't have cancer, and then within a year they got cancer or something. Are they still available to get this after they're diagnosed with cancer or with any other issue?
So we do have a 5-year look back on the health questions for a diagnosis of cancer or treatment for cancer. So unfortunately, if somebody was diagnosed a year ago with cancer and they're still going through treatment, they would not qualify for that cancer rider or the cancer standalone plan. But to your point, if somebody like the pre-X in place and the contestability in place is not meant to say that no claims are paid out within that time period, within the first 6 months or within the first year. If somebody has a hospital indemnity plan, they add on that cancer rider and they're diagnosed with cancer 2 months into their plan. This was a complete surprise to them. They had no idea. They went and got a simple scan and found out that there was a growth, something like that. This is unrelated to anything pre-existing. They did not lie on the application, so those claims would absolutely be paid out. That's more so for us to protect ourselves against someone who knew, okay, they found a growth, so now I have to go get a biopsy. Let me get this rider in place just in case it's cancer. At that point, we would be able to see that it was pre-existing or maybe they lied on the health questions. Does that answer your question, Irene?
Yes, but then after, let's say you paid it because they never lied or everything was a surprise.
Yes.
Afterwards, can they keep the plan for years?
Absolutely. Yes.
Okay.
Yeah.
Okay.
Those health questions, in order to qualify, are just asked at the time of the application. As long as they have the plan in place, it's guaranteed renewable for life. So we don't kick them off after they file a claim, or we don't kick them off once they get to a certain age, anything like that. As long as they're paying their premiums, we will continue to pay them benefits and pay their claims if they need them.
And also, and I can't recall if you mentioned this, Bella, but when they pay out the cancer, so let's just say they're diagnosed with a life-threatening cancer, they receive the benefit, then it rebuilds again. It's not like they've used it, they can never get it again. If it recurs, then I think, is it 5 years where they start building 20%, 40?
Yes, yeah, gradually restoring over a 5-year scale.
So they will restore that cancer benefit. So if they do get diagnosed again, they won't have to, they'll at least get some benefit. Cool. All right, guys. So email me. There's Bella's contact information. So she is our broker sales manager. She's there for you to text, email, hit her. Is that your office number?
That's my cell phone number. Yes.
Look at that. We got her cell. Okay.
Yes.
So if you need some one-on-one help from her, she's making her living taking care of us guys. So take advantage of the assistance. There's other carriers that do this, guys, but I would just tell you, I've tried, and I just, there's no personal attention. At least here with Heartland National and with Bella, hey, have some questions. How do I do this? Get a hold of them. Okay. So don't be shy. Don't be shy, contacting her. So there's her information on the bottom left, Bella. How do you say your last name, Bella?
Steckity.
Steckity. Okay, got it. And there's her email. So jot it down, guys. We've got 3 messages that see here on here. Liz, I like the 7% discount. Hey, a discount is a discount. I love it.
Right. Yeah.
So,
that household discount is available on hospital indemnity and home health care. It's not available on the cancer, heart attack, and stroke standalone, which we did not focus on today. That plan is a little bit different. We'll calculate premiums based on the age of the youngest spouse. So that's kind of where the discount portion comes in there. But that 7% household discount is available for hospital indemnity and home health care.
So Bella, this is, I'm going to look at my schedule. Let's connect again and let's do the cancer. We haven't touched that at all.
Absolutely. Yes.
Okay.
Well, thank
All
you
right,
so
so
much
guys,
for having me on, Luis. I always love getting to work with your team and getting to train you all on some of our products. So I look forward to getting something scheduled soon, and we can go over cancer or overcoming objections or so on and so forth.
Awesome. Awesome. Okay. Thanks, Bella. Hey guys, thank you for being on today. We'll see you guys tomorrow.
Have a good one.
You too. Bye-bye.